Last year, nursing organizations across America, including the Academy, were called upon by First Lady Michelle Obama and Dr. Jill Biden to become part of the White House's Joining Forces initiative. Joining Forces is a nonpartisan national initiative to mobilize all sectors of the country to assist military service members and their families. The Academy was honored to accept the First Lady and Dr. Biden's call to assist America's bravest. With guidance from the Military and Veterans Expert Panel, we have launched the public awareness campaign called Have You Ever Served in the Military? The campaign will encourage non-VA health providers to inquire about their patients' military history to provide appropriate and customized care. We are rolling out the campaign in 10 states and the rest of the country over a 3-year period. If you would like to learn more about the campaign, please visit HaveYouEverServed.com. With this campaign in mind, we have invited Ramon Lavandero to introduce our keynote speaker. Dr. Lavandero is a Senior Director of the American Association of Critical Care Nurses and a Clinical Associate Professor at Yale University School of Nursing. Ramon?
Joanne, thank you so much for the honorary doctorate. You know, it's always nice when a family member comes home, and as a fellow of the Academy, our speaker is family. She's also family for the Yale University alumni among us today, and she's especially family for anyone who serves or has served in the military. Dr. Linda Schwartz is a very accomplished relative. She's the first woman and nurse to be appointed Commissioner of Veterans Affairs for the state of Connecticut, based on her long history of involvement in nursing and veteran organizations. This includes more than 10 years as an advisor to the United States Department of Veterans Affairs, and this past August, President Obama nominated Commissioner Schwartz to be Assistant Secretary of Veterans Affairs for Policy and Planning. Dr. Schwartz served in the United States Air Force on active duty and as a reservist. She retired from the military in 1986 after sustaining injuries in an aircraft accident while serving as a flight nurse. Her passion is to heal the wounds of war, and as an advocate and activist, she's testified on veterans issues to both houses of Congress, the National Academy of Science, the Environmental Protection Agency, the Department of State, among others. I mentioned that she studied at Yale, where she received both master's and doctoral degrees, her doctoral degree in public health. And earlier this month, the School of Nursing honored her during its 90th anniversary as one of the 90 alums whose exceptional achievements exemplify the school's mission. Dr. Schwartz is experienced in the governance of volunteer and professional organizations. She served on the boards of directors of the American Nurses Association, the Vietnam Veterans of America, and the Vietnam Women's Memorial. She's no stranger to scholarly pursuits either. She's principal investigator of the Vietnam Nurse Health Study and co-chaired a Connecticut General Assembly study of the effects of depleted uranium on Gulf War veterans. As Joanne mentioned, a year ago April, the Academy joined 150 nursing organizations and 500 nursing schools and our nation's 3 million nurses to support joining forces. The White House initiative to increase our understanding of health issues affecting our troops, veterans, and their families. Today, as Influence of Health Policy, we've invited Dr. Schwartz for a conversation about challenges and strategies in ensuring excellence in their care. Linda, your Academy family welcomes you.
Good morning. Let me just ask, if you can, will all the veterans in the room please stand and be recognized? Now, can I ask any member that is here who has a veteran in their family, will you please stand up? That's fathers, sons, daughters. We all have a stake in what I'm about to say. But it is good to know that in this day and age, the families of those who serve are as vital to the mission readiness of our nation as ever before. Next year, I have to tell you that last night I was with my father's ship reunion down the street. But I want to say this, that it reminded me that next year it will be the 70th anniversary of D-Day, and perhaps it was a harbinger of my career that my father's ship, the Susan B. Anthony, was sunk off of Omaha Beach on D-Day +1, but it holds the Guinness Book of Records for the largest sinking of a ship with no loss of life. Also, we just celebrated our 60th anniversary of the ceasefire of the Korean War veterans of war, the ceasefire. And although we know that things continue even today in North Korea, it was time that we honored those veterans who stepped forward and served during Korea. We are also in the 50th anniversary of the second longest war, Vietnam. And believe it or not, it was 1990 when we did Desert Storm. So the number of veterans from World War II are on the decline. However, as we are witnessing and we are experiencing, many of you have said that by standing with your families, you know that we are doing war in a different way. We are heavily relying on our reserve components, the Guard and the Reserve. They are taking the bulk of the mission, and then they come back to our communities and they resume their lives. I myself was a reservist when I was injured. I had a 6-year-old daughter. My husband is a self-employed restaurateur, and I could not even tell you my telephone number after that accident. So I began my climb, my education, so to speak, on this subject in 1983. And some of you in this room were with me, were there when that happened to me. And I think that we were all surprised that I even am able to walk and talk. But let me say this. Not only are we talking about the veterans, we are talking about the men and women who this very day are on the outposts of freedom, protecting our freedom and defending our principles and our beliefs, and the weak and the poor and the innocent. It is my honor to speak on their behalf to you today and to bring into focus our new, I hope I'm going to do this right. This is Healing the Wounds of War. And as you can see, the quote from General Washington, "The willingness with which our young people are likely to serve in any war, no matter how justified, shall be directly proportional to how they perceive the veterans of earlier wars were treated and appreciated by their nation." And now with the all-volunteer force, we know in our hearts that it is more important than ever that our veterans receive absolutely the best care. But it's different. It's very different, and I'm going to walk you through why it's different. First of all, veterans in America, people can argue or debate the numbers, but it is around 22.3 million, and now more than ever, you can see that women veterans are becoming a more important part of the force. But on my all veterans, I wanted to kind of call your attention to the fact that those of us who served during the Vietnam War, we still remain the largest population. However, if you see the women veterans, you can see that the mean age is not exactly the Vietnam age, and that's because if any of you served during that time, maybe you remember when I joined the Air Force, I could not be married. I actually had to get my commander's permission to marry my husband. And I also, if you were expecting a child or pregnant, you had to leave the military. And it wasn't until my daughter was born in 1976 that they actually allowed you to stay on active duty if you had a child. So that is why you see more women joining the military now than ever before. And that's due to the fact that we have the all-volunteer force. And women are actually ascending to some of the more vital, and now we know that we had a 4-star General Dunwoody, and there's no ceilings that women can't challenge in the United States military today. Yes, bravo. I also wanted to show you that sometimes we hone in on the fact that this is a veteran population by period of service. For me, and for many, we talk about the combat veterans, but as you can see, the peacetime veterans are right up there too. And for many states, and for many things, peacetime veterans have been excluded. But what I'm trying to show you is that, and it is a very sobering reality to me as a Vietnam veteran, that as we hopefully have no more hostilities, that our Gulf War veterans will become the most important group of veterans in the United States. They'll have the largest population. They're different, and we will talk about that in a little bit. I'm bringing this up because, first of all, I'm trying to enlist your help in this mission. I was a flight clinical coordinator, and my job was to organize missions, and so I'm organizing this mission. This slide actually shows you, and the reserve RC is reserve component. This is showing you the disbursement of our reserve component. That's the reservists of the Air Force, Army, and Navy, and oh yes, Marines. Any Marines here? Okay. But also the fact that they're not only in large cities. They are everywhere. And the only places that you see where there's white, those are the only counties in America that actually have no veterans in the reserve component. But we're just talking about the reserves and the National Guard. The reserve component is the Guard too. We haven't talked about or shown where the active duty forces are because nobody's really got a good take on that. And as we were discussing earlier today, really the reserve units are the ones that need the most help to get into the system and to understand the system. And these are probably the people that are using healthcare providers in the community for their healthcare. The vision. And I'm one who believes in no wrong door, and in which any service member or veteran and their family members can come. And with your help, it's an achievable goal. I'm just going to kind of give you a vague idea of what we're talking about as high risk factors that were encountered by veterans who you may encounter in your practice. The World War II veterans, and that was 16 million Americans, over 1.3 million, but we're losing them at a very high rate. Yes, they are the greatest generation, and they're still in there fighting. I can tell you, as a commissioner, I have many conversations with them, especially about getting into the VA. But many of them had no idea about the nuclear exposures or cleanup. A gentleman I was giving a speech and talking to veterans about using their benefits, and he said, well, I don't need to go to the VA. He said, I wasn't exposed to anything. I said, well, what did you do in the military? And that's the next question you got to ask. If they said they served, you've got to say, what did you do? He said, well, my job was to clean out Hiroshima. I said, well, do you know you are an atomic survivor, that you could, and he said, well, maybe that explains what's wrong with all these things on my body. But you see, these are a group of very courageous and very hardcore veterans who think everybody else needs it but them. I'm bringing this up, the VA cares, because it's a very important thing for you to know too, that many people did not know that they were exposed to radiation. And I can just say that being from Connecticut and living in the Groton, Connecticut area, I learned real fast that during part of the work with the submariners, they actually inserted radium in the nasopharyngeal areas to shrink their sinuses so they wouldn't have trouble when they were submerged. They didn't know that this would, and I think that's part of the issue is we didn't know then what we know now. Another thing that people don't realize is that during Korea, not only did they have they had chemical warfare experiments, but they also they used Agent Orange in Korea too. So some of the things that we have learned since then, in the Vietnam War, for example, there were 9 million people who were mobilized and served in uniform, but only 3.4 of them actually served in country, and that's not even a really good accounting of it because people really didn't know. But after about 50 years, they finally decided to have welcome home ceremonies. And when we did, and we got out and we saw that some of our veterans who had no idea of what the effects of Agent Orange really are, the lag time from exposure to the appearance of symptoms in Agent Orange is about 30 years. So people thought for many years that they were literally unscathed. I just had a discussion just yesterday with a family who their father was never a smoker. He has cancer of the lung. I asked them where did he serve during Vietnam? Yes. Where did he serve? In Da Nang. I said, if he has lung cancer and he served in Da Nang, he has a presumptive disability. I think some of this is just knowing the ropes. And since I've been working on this in 1983, I've learned a lot. But knowing that all he had to do was prove what his diagnosis was and that he was in Vietnam and he would be treated by the VA and might be eligible for compensation depending on the severity of his injuries. I'm going to share another story because this is really how you can become very involved in this. The first thing is that in every one of the states and territories, there is someone like me. Generally, they're taller and they're men. But they are tasked by the state government to oversee the services to veterans. So I have a counterpart in Maine who called me 3 days before Christmas and told me that there was a veteran visiting Connecticut from his state who was very, very ill. His ex-wife had come to the Maine Department of Veterans Affairs asking if there was something they could do. So I took the gentleman's name and I got his social security number because everything in the VA does run on your last 6. And we were just lucky because he was in the critical care unit of a local hospital. They really had no idea. He was in crisis and didn't know he was a veteran. So we validated and authenticated his veteran status, and I sent one of my service officers over. Service officers are specially trained and accredited by the VA. They are my employees, and he went to the hospital, talked to the veteran, asked the doctor. The doctor says, we're thinking that maybe he might have non-Hodgkin's lymphoma. My service officer said, he served in Vietnam, and it's a very good chance that he might have non-Hodgkin's lymphoma because that too is one of the presumptive disabilities. Because of the weather and so forth, and the partnership that we have with VA Connecticut, we were able to bring this gentleman to our hospital. I have a chronic disease hospital. I have my own physicians. I have my own nurse practitioners. And I was talking to this veteran, and he said, I have been sick for years. No one knew what was wrong with me. I could not afford to go to the doctor, and so I have just suffered. Please remember that if someone would have said to him, "Have you ever served in the military?" "Yes." "Where did you serve?" "I served in Vietnam." They might have been able to think along the lines of those specific diseases that are rated as veterans of Vietnam having a higher risk for. It might have made his life a lot easier, and that is part of our mission. In Operation Desert Storm, you can see that the number of women serving is relatively high compared to the percentages in former wars. But here's another operation where we had exposure to many hazardous substances, including the immunizations. We actually lost a Connecticut National Guard because of his immunizations. Also, I just want to say one thing about depleted uranium. Depleted uranium is not that it's radioactive. Everybody thinks, why are we having people handle radioactive materials? But it's a very interesting and important because depleted uranium is one of the hardest substances known to man. It is on the point of many of our armaments, our trajectories, our missiles. And the beauty of this, if you are a warrior, is that as it goes into, it penetrates, it just keeps sharpening itself so that it can penetrate even further. And it's the dust. It's the dust from the depleted uranium that is the causative agent for many, because it's breathed, especially if they were taking care of the tanks where these armaments were being fired. It goes into the lungs, it goes into the kidneys. And so if someone would say to you, yeah, I cleaned out tanks where they were using depleted uranium, that you would want to take a look at the lungs and the kidneys specifically. I want to just say Operation Iraqi Freedom, Operation Enduring Freedom, and Operation New Dawn is what we're in right now. And just to set the stage, I might say OEF, or OIF, that's Iraq and Afghanistan. But the point being is that they're coming home with a constellation of symptoms. We are just beginning. This war has helped us understand the dynamics of traumatic brain injuries, but be not deceived. My father was a gunner on a destroyer for 5 years during World War II. He was firing the big guns. He had traumatic brain injuries too. We're just now acknowledging that and the far-reaching effects that it has. As we learn more and more about this, I want to just say another thing too about the multiple deployments. We have no idea. No idea what the fallout from that will be. Some of our Air Force units have been deployed as many as 8 times. I've had veterans come to us who have 3 tours. I had a woman veteran, 2 tours in Iraq, 1 in Afghanistan, and 3 children later. She's actually now getting some care for some of the injuries that she had, but she was homeless on the streets of America. She went to one social service after another. Did anybody ask her, did anybody think that she might have served in the military and be eligible for a vast array of VA services which could have preserved her and her family? Lucky that someone just was in the office when she was looking for assistance. So we don't want to make it the luck of the draw. We want to make it an expectation that veterans can be identified and connected with the services of the VA and their states. I like this. See that plane? That's where I used to work. I was a flight nurse. I had the great honor to fly for 7 years, fly the line. So, you will hear different numbers. when I talked to you in the beginning, I talked about the number of all veterans. But because your chance of seeing a veteran now is from the OEF, OIF, and New Dawn. And so we wanted to just give a little bit of more of a concentration and focus on this. This is talking about the OEF, OIF veterans, and why is it that they're using the VA? They went all the trouble to get this to me, so I'm going to use it. Oh. Why 56% when I just told you about 22% of veterans use the VA? Because VA has made an important change to their entrance. Any veteran returning from the field is allowed to go without question, no adjudication of claims, so you can use VA. They are welcome at VA so that they can go to the VA, get health care. If there are service-connected disabilities or illnesses, they can be treated and identified and documented. But that's why in the state of Connecticut, and I hope in all your states, we have a yellow ribbon when people come home. Yellow ribbons for people, mostly the National Guard. This is where they learn what they're eligible for and immediately enrolled in our state in VA healthcare. Our studies tells us that they go there maybe once or twice and then they don't go in again. But from the get-go, that's how it starts. So at least they're in the system in case they should have a need as they age. For example, some of my friends who are Vietnam veterans never went to the VA. The criteria for going to the VA has changed several times in our lifetime, and so many of them now, with shrapnel in their legs, are wishing that they had enrolled in VA healthcare. It's a little easier when you're enrolled, but they are getting their care. So this is something I wanted to bring up about nothing prepares you for the reality of combat. Remember I said that we had 8 million or 9 million people in the Vietnam conflict, and only 3 million of them are actually stationed in Vietnam. There were a lot of people in the support roles here in the United States and around the world. But when we're talking about our troops today that are being deployed to Iraq and Afghanistan, we're talking about people who have actually seen small arms fire, who have actually been attacked. These are the people that are serving. And 62% of them were unable to defend in a hostile action. I just want to take a minute, and I just want to tell people you did not start the clock, so somebody's going to have to help me with the time. Traumatic brain injuries. Does anybody see Saving Private Ryan? Yeah. Do you remember the scene where Tom Hanks and his unit are actually in a firefight, and Tom Hanks is knocked to the ground, and he comes up, and he can't hear, and he can't talk, and all these people are trying to kill him. Can you think of a more vulnerable place to be than can't talk, can't hear, and somebody's trying to kill you? Not one, but many. But think about that for some of our veterans who served in Iraq and Afghanistan, who do that day after day after day. When you hear, you know, the roadside bombs, the concussion, that is a blast concussion. And that's what happens. So even if you are the toughest Marine, and they are tough, one thing is, if they can't hear and they can't talk, it's a pretty scary place to be, isn't it? So that's why this is a little bit different than any other conflict, because everybody that's been deployed has been placed in harm's way. This is another one, which I think this came from Battle Mind. I got it, Battle Mind, and just the statistics come from those who were deployed. So you can see that they have actually been subjected to a lot of trauma and stress that may not have been characteristic of earlier wars and conflicts. Military sexual trauma. I had the opportunity to testify before the Senate last year. At that time, the report was that 23% of women who served reported that they had been sexually assaulted by a coworker. I asked the Senate, what would happen if they said that 23% of the women that work for IBM had been assaulted by a coworker? Wouldn't you be investigating that? Yes. Would you tolerate that? No. We can't tolerate this, and it is very important for everybody to remember that in the military, the Department of Defense defines military sexual trauma as rape, sexual assault, and sexual harassment. And that, not just women report military sexual trauma. In the beginning of when VA was actually addressing this, I was the chairman of the VA's Advisory Committee on Women Veterans. We started programs in the VA, and we found that the first people to come were actually men who had for so long had to deal with the indignities and the sadness and the stress of being a victim of military sexual trauma. There are some questions that can't be answered on Google. So in Connecticut, we decided, well, we did a National Guard. That eagle is the Department of Veterans Affairs, Central Connecticut State University, and the Department of Mental Health and Addiction Services. And I just want to give a plug for the Commissioner of Mental Health and Addiction Services is herself a nurse. So we joined together and we did an assessment of our returning veterans. We didn't get everybody because a lot of them don't like to, we got about 650. For us, that's good. But it did give us some things that we think are very characteristic of veterans returning today. And that is, there's one thing I admire about this generation, that they are for each other. They may not have served next to each other, but they are for each other, and that helps to build the resiliency. Someone this morning talked about veterans on college campuses. What we have done is we have started the OASIS program. If you went to Yale, you know why we call it OASIS, because there was no green there. So we said green in the middle of the academic settings. The importance of camaraderie. I think this is, oh, there it is. The importance of camaraderie is something to build on. And so these OASIS centers are drop-in centers in our campuses and all of our state universities and community colleges. And it's helped to build up a spirit, because someone mentioned this morning, not all veterans are welcome on college campuses even today. But they came home with the sense of isolation, of not being understood. And they found that being with other veterans, even if they didn't serve with us, that they did not have to explain a lot of what they would have had to explain. And the communications difficulties with family is one of the leading causes of why divorce is so high in this particular generation. And my women veterans came out and wanted to be sure that you all know that their experiences are not the same as men. It's I would say that when I first met some of our returning veterans, there were 3 women in this unit, and we were doing a briefing, and at the end of the briefing, I was the only woman standing. Everybody else was a general or a man or something, and these 3 women came up to me and they asked, because I was talking about what we do for veterans in Connecticut, and they said, well, do you have counselors? And I said, yes, I don't have them, but I can certainly hook you up with them so that you can have the care. And I said, but excuse me, may I know the nature? Thinking military sexual trauma in my head. And they said, well, we were deployed, we were in a Humvee, we were attacked, explosions, and our buddy's arm landed in our lap. And I can't get that out of my mind. But I don't want the rest of the guys to know that I can't handle it. So we're, in the vernacular, we have sucked it up. but it's really taking a toll on us because they don't, the most important thing is they want to have the trust of the people with whom they serve. They do carry their own weight, and I'm mighty proud of them, but we were able to help those ladies. We found that 25% of our veterans reported symptoms of post-traumatic stress. And I just put traumatic brain injury here because I wanted to say that some people use the vernacular blast concussion. That's a little less daunting to a generation that has been having their game, my head is in the game, my head is screwed on right, and now you're telling me I have a traumatic brain injury, my head's okay. My head's okay. So blast concussion and the experience of, it oftentimes, let me just say, it often deters them from even going for treatment. Even it's so subtle. And when you have post-traumatic stress and the TBI together, the overlay, it takes a while before it actually, you can actually say what treatment is the best for that individual person. But the blast concussion is something that many of them are actually very comfortable with. What we did at the end was we did a cluster analysis, and what we found from our sample was that it was the younger veterans, the ones that were less educated, and that means most of them who were like high school had not gone to college at all. Remember, people joined the reserves and the Guard to go to college, not to war. So, and many of them not in a relationship, and unfortunately, they were more likely to have been on active duty. So there's something to be said for the reserves and the Guard, the camaraderie of your group, because many of them who are just coming home on active duty, they're the ones that are having the most difficult time. I want to say something about the stigma of seeking help. Today we have heroes, we have warriors, we have warfighters. And warfighters don't need any help, by the way. They'll be the first to tell you that. So, really, and this came right out of what they wrote for our study. I would be seen as weak. Commanders would not trust me. My unit would have less confidence in me. See, this is the difference. They're not out. They're not discharged. They're still in reserve and Guard units, and they still have to maintain their warrior, warfighting persona. So, it doesn't matter who gets up and says seek treatment. Sometimes, as I mentioned, the families are the ones that get them into treatment. They go for the sake of their families, for the sake of their children. And we found that those who were most in need of help felt it was more of a stigma to seek treatment. Back again, switching the service members and their families. If anybody knows Dr. Harold Cudler from the Durham VA, he was going to come and help me today, but he sent his slides in his place, and I'm reading them to you. No, we've actually presented before. We presented in Montreal, and we found that we were simpatico. But this is from his work in North Carolina. But it says something. It says what the Academy is trying to do. Community providers and programs, are they prepared to identify and treat and triage? Family members are also very affected by the deployments, especially multiple deployments. So we need you. On behalf of our service members, the military, we need people that will be open to this. And I am very proud that the Academy has adopted this. When I was young in nursing, the Academy was the epitome of the accomplishments of nursing. Many of my friends, Virginia Henderson, Florence Wald, Edith Patton Lewis, and Donna Deers, they were all my heroes. So when I was able to engage the Academy in this, I felt we were the A-team. We have the A-team working on this because you can do many things. This card is one of the things that we've developed, and it's very basic, I think we're going to also have applications, but the idea is to put this in the hands of all of our healthcare providers across the nation so that they can at least know what we tried to do, and it is very busy, I agree. I tried to read it this morning, and so did the people on the expert panel. This is our project, and we said, whoa. So, is it really? I have only had one cup of coffee. Maybe I need another one. But we're working on it. It's a work in progress, and we have support from the Veteran Support Foundation. And with this as one of our tools, and many others, the website, I'm convinced that we have the opportunity here to change dramatically the way that healthcare is delivered in America. Because there are people who have diseases that don't even know that they are eligible for help from the VA. So something we also found, we did a training for clinicians in our community, private clinicians, but we had the teachers, the professors, the educators were our own military, and this is some of the things that they passed on, that they really expect professionals to know what they're doing. They don't, and they are used to facts and real deal. I mean, you can tell them like it is, but please be honest. If you don't know the answer, say so, because they know when you don't know, and it doesn't engender a sense of trust. No bogus answers, and they, especially those coming out today, they're very into the regulation and what the regulations say, and so if you say there's a policy that says that, they believe it, and if there is anything that diverts from that, you better tell them. But I'm going to tell you this. Confidentiality is extremely important. I was just talking with a group of returned veterans who had been back for a while, and one of them came up and said, if I use a private clinician, does this mean that they're going to tell the VA? Does this mean they're going to tell my commander? Because we have people that want to go, but they're afraid it will ruin their promotion potential. I said, private providers will maintain your confidentiality. And that's the only way some of them will get help. That's why they're not going to the VA. You need to, if there is any issues with confidentiality, you need to tell them that up front. You need to tell them up front. And they believe that the professionals are supposed to be the ones to fix the problems. It's not their problem, it's your problem. And some effective communication key, you have to leave politics at the door. And it depends on what part of the country you are in, what the politics are. So that's why you leave them at the door. Any good clinician will do that. Be available to them. I think that's one of the factors that's most important. And tap into their strengths. Resiliency is a very new concept, however, it is as old as we are. Help the soldiers to help themselves, because that's the way they really like it. And accept the soldier as he or she is. Some of them, they are so gung-ho, and some of them are just not. But any patient that came into your keeping, you would treat them this way anyhow, I really believe. And start where the soldier is, not where you think they should be. It's like when I said, oh, may I know the nature of your issue, thinking military sexual trauma? No, it was real combat war situation. And foster the independence and self-reliance. And I think sometimes we've had some clinicians who really get very attached to their veterans, and we know that, but then some also get very angry. I had a nurse tell me that she was sick and tired of these veterans coming in waving their disability like a flag. She was talking about one of our clients who lost his eye, his arm, and his leg, and he was waving it like a flag. So it's there. Please, you know it and I do know it too. And I just want to point out there is a difference between the states and the federal government. You know, we work for the governor, they work for the president, but we have your state, each state, if you don't know what it is, you go home and find it on the internet. And if you don't know your state director, we have a list. Because many of them are so excited about this, they can't stand it. I have some time for questions, but I just want to tell you about this kid, Jordan Pearson, Lance Corporal Jordan Pearson. When I first became the commissioner, I do get emails from people in the combat zone, and I got an email from Jordan. And he had been wounded, and he was in a hospital, and he was thinking of coming home. And he wanted to know, what did we have for him when he came home? And so I wrote back, well, we have a website. Take a look. Next day, I've looked at your website, and that's for the old guys. It's not for us. So I went home and I looked at it and I said, Jordan, you're right. It's for the old guys. What do you want? What do you want out of life? He said, I want to go to school. I want to have my own house. I want to have a job. I said, well, Jordan, when you come home, please stop by my office and we'll help you. About 3 months later, at an event I was at, we were asked to have a moment of silence for a veteran who was killed in action from Milford, Connecticut. And I said, please tell me his name. I said it was Jordan Pearson. So you see, Jordan gave me my marching orders. We have to learn every single day what our veterans, what their families need. And so I put this here just to remind myself that I work for Jordan and his family. I work for veterans. And I just would like to say, I hope that you will join us, because just as there are veterans who are in each and every town and city, I think that I have learned one thing, that nursing is in an excellent position to make a big difference. And I take a page from Virginia Henderson when I say, nursing must be the voice of those who have no voice. And the people that don't have voices in America today are the ones that have stood on the outpost of freedom for all of us, so to protect us and protect our country and our families. They stood for us. Now I ask you all to stand for them. Thank you. I wish we could capture that and send it out for them all to hear. Are you all in? Yes. Great. I have some time for some questions, they said, because they got the clock back on time here. Is there any questions? It's hard for me to see. There's a question. Okay, good.
Hi, my name's Holly Shader McCrae from Vermont, and I was really intrigued by you're talking about we should ask the question, have you served? And I'm wondering if you could play that out a couple more sentences, because I'm thinking it'd be a really great thing to embed in our electronic health record as part of the admission assessment. You know, we're not a VA place. So my question would be, so if the nurse asks that, all right, what's the cascade?
All right, I'll be the nurse.
Okay.
Have you ever served in the military?
No. Yes. Okay. Yes.
Okay. Have you or anyone close to you ever served in the military?
Yes.
Who served in the military?
I'll make it up. My nephew.
Your nephew. What did he do in the military? Do you know?
Yeah, he's an Army Ranger.
He was an Army
In
Ranger.
Iraq.
Where did he serve?
Iraq.
Okay. Are you very close with this? Does he live with you? No. Okay. Well, this is not going the way I wanted
Yeah, no,
it
but
to.
I'm just curious. Yeah, no, but I'm just curious. Like you talked
right.
about what would they
All right, I'll
expose-
take the next one.
Yeah.
I know her.
Okay.
All right. Have you ever served in the military? Or you or anyone close
I've
to
been
you?
a civilian employee in the military.
Okay. Has anyone in your family ever been in the military?
Yes,
And who would
my
that be?
father and my nephew. And my husband. Forgot about him.
I didn't forget. How did you forget? All right. What did he do? When did he serve?
My father served in the Pacific
Well, I'm more
during World War II.
interested. Okay.
My husband was in the Marine Corps during peacetime. He started out very gung-ho about going to war, and as things proceeded, he got training in, I can't remember what it's called, crash, emergency for crashes in the airports. So that's what he did at one point, and then he did other things. So while he was involved in that, he changed his mind about wanting to go to Vietnam. So I would say he was a war period,
Yes.
but he didn't go.
Well, let me ask you this. Was he stationed at Camp Lejeune? Yes.
Yes. You can, I'll say whatever you want, Linda.
Yes, okay. When was he stationed at Camp Lejeune? Oh, 1960.
1960.
All right, were you with him then?
No.
Okay. You know, there's a fact that the water at Camp Lejeune was contaminated from 1955 to almost 1990. And maybe it would be important for you to contact, or your husband to contact your state director to find out what was that contamination, and maybe it affected you or your husband. And it might be a very important thing for him to know a health risk that he might not know about.
Thank you. That's very helpful because, of course, he doesn't think he has any health risks.
Well, you never know. That's the Marines for you.
Linda, I'm Pamela Minarek. I'm now in San Francisco, but I was at Yale and had the pleasure of getting to know Linda very well there. But of course, I first met her when we were all fundraising for the Women's Memorial. So I'd like to say you've just done a fabulous job. I really appreciate what you've said here. And I'm very curious about that overburdened brochure and where I can get some of those.
Well, there's some on the table out there. And we're going to be hopefully in the... Are you in California now?
Yes.
Okay, California is one of the states. See me later.
Okay,
We have
I'll
the
do
name
that.
of the contact people.
Thank you.
Yes, General. Oh, okay.
Good morning, Commissioner. How are you? I am a veteran.
Yes, you are.
And I served with you with
Yes, you
distinction. And I want to say on behalf of this body, on behalf of Connecticut and all of us, there's not a better place for you to be. You are the advocate that we needed yesterday, today, and will need tomorrow. Linda, you are brilliant. We are here to support you, regardless of what's on that brochure. You have carried the families and the veterans of the state of Connecticut.
Thank you very much, Donna.
And
Donna
we're so
was
proud
there.
of you.
General, the chairman of the expert panel is here.
Hi, I'm Peggy Wilmoth. I'll take partial responsibility for the overburdened brochure, and we are going to hope to talk with our IT expert panel about how we can move this into electronic health records. So that's the next goal for the year. But the point I want to make, and I think it's an important balance, as we talk about the 30 to 40% of our OIF, OEF veterans coming home with some range of mental health problems, we also need to be very careful that we don't stigmatize those young men and women, and also then cause employers to have hesitancy in employing them because they're fearful of them having some problem. And I think it's a very delicate balance to walk. Because I know from my own son who's a vet, he's having trouble finding work. And, I've heard from business owners, they're worried about reservists because how are they going to, often are they going to be gone again? You're in and out of the workplace. What's it costing me as an employer? I think we need to figure out how to support our reserve component members, but we also need to be sure we don't over-stigmatize our veterans so that employers are not willing to hire them, because that's a real serious concern that many people have. Thank you.
I don't know who's next.
I'm next.
Okay.
Hi, Linda. Thank you so much for an amazing presentation. I'm Judith Shamian, and I'm the president of ICN. I am seeking your advice and your thoughts. One of the things that we've been dealing with different countries is where healthcare workers are unable to do their job the way they would like to do it or ethically would like to perform it. And yes, the Red Cross and others are on top of it, but we as an international nursing organization keep hearing about those things, and beyond sending a letter and speaking out, there isn't more that I think currently we're doing. What would be your thoughts and your advice to ICN?
Well, I never thought I would be giving ICN any advice. And I'd like to talk to you later because I'd have to give it some thought. I just really can't off the top of my head, but I'd like to explore it with you later. Okay.
Hi, I'm Deb Kenny. I'm a veteran. My father is a veteran. My son is active duty. So it kind of runs in the family. I was really glad to hear you ask, are you all in? And I was really happy to hear everybody say yes. And the reason we need to act is because the military people become invisible when they become veterans. And those people, when they raised their right arm, they signed a blank check up to and including their life for everyone in this room. And so we need to support our veterans.
Hi. Ann Norris, University of Central Florida. I'm just struck listening to at the need to really try to get this into our undergraduate nursing curricula. And I'm listening to you and all the information that you have that we don't have. And we can have our students ask the question, but just listening to you following up and saying, oh, if you've been exposed to this or you've been in this particular, war part of the country, whatever. And I'm just wondering, how can we get some of that information so that we can start imparting it to our students? Thank you.
I think that this is the beginning. It's not the end. I think that there are many educators in this room that have the rare opportunity to introduce a new thought and a new way of doing business. And I guess that's why I am so very excited that the Academy would be part of this. I've had the opportunity to speak at Duke, and I think I spoke at UConn, but maybe not on this. But many of our many states already have the fellowship program. Alabama, some joining forces. This is something I think that the Academy can address, and I know this morning that the chairman was talking about subcommittees of what we could, flesh out and develop as a criteria. As I said, I started learning this out of a sheer necessity in 1983, but I never expected it to be my life's work. I was just trying to fend for myself. It brought me, and I will say this, because I am a nurse, and I was gaining a lot of tools to cut red tape and to also believe that this was a credible and important mission in my life, I took it on. But I am not the only one that knows this. And VA, I would start working with your VA and said, in fact, Mike Pendergast is your Director of Veterans Affairs, and Florida is one of the pilot project states. So I would be glad to sit with some of the pilot project states if that was possible, or even do a conference call. But I really do believe that we are about to change the face of doing nursing assessments, doing healthcare assessments.
Dr. Schwartz, hi. I'm Joan Stanley with the American Association of Colleges of Nursing, and I just wanted to add to what the last questioner asked about how we get this in our education and our curricula. AACN does have a website, and we have a Joining Forces website, and there are a number of other organizations that do as well. But we have developed a toolkit with information for schools to help integrate it into their curriculum. In fact, I was going to contact you afterwards and ask if we can use some of your material also, because it is a living resource that we will continue to add to. So yes, that is available, and if people have exemplars that they believe would be excellent ways of sharing with other schools about how you integrate it into your curriculum or create opportunities, we would be glad to review them and have them added. So thank you very much for your excellent presentation.
Thank you. I just want to say that one of the things I did not mention, and I really meant to mention, is that over 2 million children in these United States have had one or both of their parents deployed since 9/11. 2 million children. And they are in classrooms. I worked with the Association of Administrators of Education or something. They have a toolbox too. But just think to the pediatric nurse practitioners, the family nurse practitioners and my own daughter, her school never knew what happened to me. They just thought I was a deadbeat mom. They didn't realize that I was injured until I actually made my way there. But your military members are not going to be coming to schools like that. But we want to help to empower them to do that too on behalf of their families. Yes.
Pat Hinton Walker, and I'm just proud to say I'm a former Air Force Vietnam Big Willie nurse.
Okay.
Okay, you know what that means. I served on the Strategic Medical Advisory Group of the VA, and one of my recent roles, I work for the DoD now. And would you talk a little bit about the issues related to reservists? Because at the time we had difficulty with the window of time, and maybe the regulations have changed, but we had difficulty with the window of time that they had to be able to say this was a combat-related injury, and particularly with, as you mentioned, PTSD. So I don't know if some of the regulations have changed, but the challenge was to help them understand that window of time for them to be able to get care. So would you just address that, please?
The VA made a decision early on in this most recent hostilities, because prior to this, a Vietnam veteran, be able to be cared for in the system, they had to put in a claim for disability, or they had to be financially indigent. World War II veterans, they could just walk right in and get care. But it got a little tight. So there was a requirement that you had to have a disability claim, and that claim had to be adjudicated before you were eligible for care at the VA hospital. That could take years, as we're learning. However, right now, the VA has opened the doors. If you have been deployed and you have returned within 5 years, you can go there for no questions asked. Just come on in and they'll start working with you. Another avenue for reservists are out of the loop. I was a reservist. The National Guard has a wonderful military support program, and reservists are eligible for that. But they are, I live in Pawcatuck, Connecticut, and my unit was in McGuire, New Jersey. okay? So it was very hard, but let me just say this. There is never a window of opportunity. There is no end to when that reservist can come forward and make that claim. They have to have, and I will just tell you this. I may have a doctorate from the Yale School of Medicine, but I have a service officer handling my claim. You cannot do it by yourself. And that's the fault of many of the people today. Our veterans think, oh, I can fill this form out, but they don't know the nuances of how you get this, what the documentation is. So my point is, if someone has post-traumatic stress disorder and they are reservist, they need to, number one, if they cannot, if they've outside of that 5 years, go to the vet center. How many people know what a vet center is? Okay, vet centers came out of the Vietnam War. They are community-based. They have a very professional staff, but they are able to treat veterans and families. That's one of the things they've been able to do since they started in the 70s. And their requirements are not as stringent, but they are the place to begin if someone has post-traumatic stress. They have counselors, they have military sexual trauma counselors, so that is a good place for your reservists to go. But the reserves really needs to, I know it was addressed earlier today, they don't have a line of communication and a way of keeping up with the troops.
I just think this is an important part for all of us to be aware of, not just are you a veteran? Because, again, a lot of the family members don't actually see their reservists as veterans. And so I think it's just really important that that question be raised, and that many of them think that they're past that window and don't have any access for help. So I think it's just important to ask that extended question, particularly of the Guard and the Reserve.
Well, I would say, too, to go to your state director of Veterans Affairs, because they work for the state, they work for the governor. They're more accountable than most government agencies, because if you don't take care of the veterans and the governor finds out, that you're going to hear about it. But that's where you should start. If anyone is considering a claim for disability for any time whatsoever, my advice is don't do it by yourself. Have a veteran service officer, and that is a category of people that are accredited by the VA to help develop these claims. 9 times out of 10, the backlog that you're hearing about is because claims were not prepared adequately. So if you have a vet in your family, be sure to tell them that. I'm sorry.
Hi, I'm Carrie Schuling. I'm from...
2 more questions? Okay. Three more questions.
Okay, I'll be quick. I'm Dean at the School of Nursing at Oakland University, the one that's not in California. It's in Rochester, Michigan. We did do joining forces, and the toolkit from AACN was invaluable. We now, in a curricular revision, have a separate assessment course, both at the undergraduate and graduate level, for assessing our returning vets because their problems are so complex. We also have identified a faculty member who is responsive to the vets. She works with our vet center. She also works with our students who are in our programs who are vets. It's been wonderful, and I highly recommend it. I also just have to give a plug. Our university also gives in-state tuition to any returning vet who wants to come back to school.
Well, thank you. Thank you for that.
Oh, okay. I'm Dee Lipman, a veteran, Vietnam Army Nurse Corps. I just wanted to speak shortly about the VA Nursing Academy, which existed between 2007 and 2012. And it was supported by the Department of Veterans Affairs, actually partnered VAs with universities in the hope that our students would have more exposure to the VA system, learn more about veterans, not only in the curriculum, in the classroom, but also in clinical, and also in the hope that they would choose to work in VAs. Many of our students have chosen to do that, both graduate and undergraduate. And just quickly, the 20th anniversary of the dedication of the Vietnam Women's Memorial will be happening November 11th. If you're in the area, even if you're not, we really welcome you to attend. Thank you.
Okay, who's next? Okay.
Hi, Dr. Schwartz. I'm Elaine Tayarani from the National League for Nursing, and I just want to thank you very much for your talk and tell you that, like the AACN, the NLN is committed to this work, and we just put out the other day 4 unfolding cases with simulations and standardized patients. They're available to the world. They were written by nurse educators who are veterans. They have monologues attached that we took quotes exactly from the veterans, and they're very powerful, and they're available to all schools of nursing to use freely. So we are all committed to this work, and we hope to continue to offer faculty more resources. Thank you.
Keep up the good work.
Hi, I'm Georgia Nar Savage, veteran, family's veteran, daughter's veteran. What you're doing is critical. I just have a question. I don't know how to get this forward. I'm in interprofessional education. A lot of the work we're doing today involves teaching our students to use apps that help with diagnostic decision. And it came to me as I was hearing you, some of this, it should be able to make a rubric that we could put into it as an app to say, are you, a veteran, and then
We're definitely working on that.
Thank you. Great.
Yeah, yes. This, last question.
Okay. I'm Dr. Jane Hawks. I just want to thank you for your presentation and then share my editorial board with Urologic Nursing moved forward with the Joining Forces campaign. And in March, April, our entire issue is devoted to veterans and military personnel, including an article on female urinary devices that Dr. Linda Yoder and Dr. Nancy Steele wrote, which I think is a phenomenal manuscript. But we also included articles written by the spouses of active military personnel, and so on. So that was a very successful issue for us, and I know there are a lot of other editors out there, so perhaps we can share that in some of the other journals as well. Thank you.
Thank you. Thank you for the opportunity.
I am going to make one exception to what I had just said and allow one more person to come to the microphone because I think his message might be very informative. Jesse, please introduce yourself.
My name is Jesse Kennedy. I'm from the National Student Nurses Association. Sorry, Jesse Kennedy from the National Student Nurses
President
Association.
of the National Student Nurses Association.
I just wanted to mention that on our National Student Nurse Association Board of Directors, our Breakthrough to Nursing Director is a veteran. His name is TJ Takeski. He's been working quite a bit to reach out to veterans and let them know about the nursing profession, how to get involved, and he's also working to reach out to active duty members through what he's calling Project Hygiene, where local chapters, state chapters are sending much needed supplies to active duty soldiers overseas. So if you guys have students who'd be interested in that, definitely email him. You can find his email address at nsna.org. And we'd love to have more veteran knowledge coming to our conventions. And it's definitely a much needed area, and we're definitely trying to get a little bit more experience in that area. So thank you.
Thank you, Jesse. Well, that was just outstanding, wasn't it? I mean, thank you again, Linda. Fabulous. I do want to make a statement before we take our healthy interlude. It's time for a healthy interlude and then a healthy break, but I do have to make the comment to tie this important work with our comments about the Reba de Tournier Development Fund. That sponsors and funds this initiative. So the point about how can I help advance the work of the expert panel and Linda and Peggy and the others in this important work, that is another very concrete way to say, yep, we're going to help. Thank you.